So how worried should you be about the swine flu outbreak? Joining us is Dr. Andrew Garrett, the Director of Planning and Response at Columbia University's National Center for Disaster Preparedness. Thank you for being with us.
Thank you for having me on the show.
So at first blush, the news, of course, about swine flu seems alarming. How concerned should we be?
It's a good question because right now, if you watch any of the news, it is very alarming. People are using words like panic and emergency. And right now, it's an important time for people to give folks a little bit of time to collect the information and see what it is we're facing. This is admittedly a complex outbreak situation, but there's no need for panic at this point. It's time for rational decision making, and as you notice in the federal government and at all levels of public health response, people are taking steps to prepare for the worst but expect the best at this point.
And as we've seen, there are governments across the world that are looking for possible cases and acting upon those. They found some even as far away as New Zealand. How is it able to spread so quickly?
Well, that's an important point, that people are actually actively looking for the disease right now, and the capabilities of the global community, the global public health community, to respond to public health emergencies has increased a lot in the last few years. The United States and the World Health Organization, the different countries are speaking with each other and trying to really have an open community about how to respond to this. Right now, they're trying to define the cases and see what it is they're facing, see where the virus is spread at this point. And
I presume it's our love of travel and the jet age that allows for it to move so quickly.
Yes, sir. One of the things we do with our demand for convenient transportation is that we do facilitate things like a virus that can actually be a little bit contagious for a day before you get sick. If you happen to be in that shape and you get on an aircraft, you can be anywhere in the world in just a few hours, and an area like airport like Mexico City's airport sees tens of thousands of travelers a day. So you can imagine it's not a far stretch to see someone who potentially was sick then traveling to New Zealand or Canada or anywhere else in the world. Is
there any way to predict when this outbreak could peak and you know, how far it will spread?
It's a really good question, and it's the million-dollar question to some extent. Right now is very early in the process, so public health officials are trying to just define what it is they're facing in terms of defining this complex outbreak situation. So right now they're seeking hard to identify cases. They're looking to determine whether all the cases of people being sick in Mexico were all due to swine flu. They're genetically matching that virus to cases in outbreak cases, in the United States and several other countries now, trying to define the terms and trying to define where it's gone at this point.
And as far as practical advice, precautions?
So the message will sound fairly familiar because it's the one we tell you every wintertime for seasonal influenza, very similar to what we're facing here in terms of how the virus works. Good hand washing, staying home if you feel sick, and thinking about a flu shot. Now, the question about a flu shot is whether it's offering some protection against swine flu. The answer is they're not clear at this point, but it certainly isn't a harmful effect and has a great deal of benefits in terms of preventing against seasonal flu. So important to think about that for this year and next year.
Dr. Andrew Garrett, thank you very much for talking to us.